So I'm Ed Jabbari. I'm a consultant neurologist at the National Hospital for Neurology and Neurosurgery, and I'm also a research group leader at the UCL Queen Square Institute of Neurology. My clinical and research area of expertise is in movement disorders, and more specifically, Parkinsonian disorders. So these can manifest as things like tremor, stiffness in limbs, slowing down, and problems with walking and balance. But these patients can also experience a number of non-movement problems. So these can be issues involving sleep, bowel and bladder function, and also cognition and mood. So the most common of these disorders is Parkinson's disease that many will be familiar with. But there are also rarer conditions, a group of conditions known as the Parkinson-plus disorders that resemble Parkinson's disease, but they are distinct conditions that actually progress very differently to Parkinson's. I also look after patients with young-onset presentations of a Parkinsonian disorder, where the likelihood of an underlying genetic cause is much higher. One of the challenges at the moment is that there are no tests that can definitively diagnose Parkinson's disease early and accurately. So this is where movement disorder specialists like myself bring our expertise in our ability to detect the symptoms and signs of these conditions very early on, when they may be very subtle, in order to give patients an accurate clinical diagnosis. Aside from building long-term relationships with my patients and guiding them through these chronic conditions, I think the most rewarding part of my career is the fact that I'm able to blend clinical work with research. So I'm able to be at the forefront of research discoveries and research advances, whether they be in treatments or new tests, and being able to directly see the impact of those research advances on the lives of our patients. So I lead a research group at UCL, and the work that we do is very translational. So in a nutshell, we work to develop novel tests for diagnosing Parkinson's disease and the Parkinson-plus disorders earlier and more accurately. And this is to address the issue of potential misdiagnosis and delays in diagnosis. We also work to discover novel treatment targets for these conditions. And finally, we also conduct clinical trials, and this also includes clinical trials with novel designs that are aimed to improve the efficiency in the way that we test new potential treatments. Well, I'd say what we have here at the National Hospital for Neurology and Neurosurgery is the perfect blend of world-class clinical expertise, combined with the availability of the latest advances, whether it be the latest tests or treatments. And all of this is fueled by groundbreaking research that's taking place right here in Queen Square. So it truly is a centre of excellence.